Good morning. As you're joining today, my name is Susan Stellan. We'll get started shortly, give people time to join. But if you'd like to introduce yourself in the chat, we'll be using the chat box. You could just add your name and, your role and where you're joining from today. As more people join, I'll just repeat that. We'll get started shortly, but if you want to open the chat box, we'll be using that today, and just add your name and your role and where you're joining us from today. That would be great. I see some people chiming in there. Looks like people joining from around the US.
We'll give people maybe one more minute to join, and then we'll go ahead and get started. So thank you all for being here. And as Susan said, please feel free to introduce yourself in the chat so we can get a sense of who's with us today. Wonderful. We have a lot of different folks from a lot of different places. So I think we'll go ahead and get started. Please continue to introduce yourselves in the chat, and we'll start the webinar. So Susan, you can go ahead and advance. Thanks again. Just an invitation. We're very happy to have you all here with us. An invitation to introduce yourself as we're waiting for everyone to get logged in. My name is Ann Murphy, and I'm an associate professor in the Department of Psychiatric Rehabilitation and Counseling Professions at Rutgers University. And I'm going to be hosting the webinar today. I'm also the director of the Northeast and Caribbean mental health technology. What am I the director of? Mental health Technology Transfer Center. Oh my goodness. It's not even that early. We're happy to have you all here. Go ahead, Susan, you can keep going. The Northeast and Caribbean Mental Health Technology Transfer Center is a SAMHSA-funded training and technical assistance center that's been funded for the last 6 years now, actually, to provide consultative services, training, and other supports and resources to try to enhance the capacity of the behavioral health workforce. We've also, over those years, received supplemental funding to support school mental health initiatives within K through 12 education. We are going to be recording this session today. We'll also be using the chat feature extensively, as you guys already are, so thank you again. Throughout the session, both Susan and I will be keeping an eye on the chat, so feel free to add comments, ask questions. If you want to make sure that everyone else can see your comments, please just indicate that in your chat box. There's an option to select making your chat visible to everyone or to just the host and panelists, which would be Susan and myself. So you have control over who can see your chat post, and just make sure you use it so that the right folks are seeing it. You will also have the ability during today's session to raise your hand if you want to be unmuted to make a comment or ask a question. Susan will be prompting you to do that throughout the session. So if you'd like to be unmuted, raise your hand, and then I will unmute you so you can comment. Next slide. So this is, as I mentioned, a SAMHSA-funded project. At this time, Miriam Delphin-Rittman is the Assistant Secretary for the Mental Health and Substance Use at SAMHSA. The opinions expressed here in this session are the views of the speaker and don't reflect the official position of the Department of Health and Human Services or SAMHSA, and no official support or endorsement of DHHS, SAMHSA, should be inferred from this presentation. Throughout the MHTTC network, we strive to use language that's affirming, respectful, and recovery-oriented. We know that there is not universal agreement around different terms and language usage, but we do use terms that we believe and hope to be respectful and supportive of the communities that we all work with. And now it's my pleasure to introduce our speaker today. Susan Stellan is a public health researcher, educator, and communications consultant with a background in journalism and collaborative storytelling. After completing a master's in public health in 2019, she's worked on projects to reduce overdose deaths, reform punitive criminal justice practices, expand access to harm reduction and treatment for substance use disorders, and counter stigma that can be a barrier to seeking help. She facilitates training workshops on a wide range of topics, aiming to present research in a way that's accessible to people in a variety of roles impacted by substance use and addiction. And she's going to tell you a little bit more about herself here, but we are really thrilled to have you, Susan. So thank you for being with us, and we look forward to your presentation.
Great. Thank you, Anne. I appreciate the introduction, and thanks to all of you who are here today. Just a reminder too, if you haven't already, please feel free to introduce yourself in the chat and just let us know, your name, your role, and where you're joining from today, just so we can get a sense of who's here. Just to add a little bit to what Anne spoke about, I spent much of my career in journalism and teaching media ethics, so you'll see that focus on sort of how media and sources of communication shape our views throughout some of this workshop today. In 2017, I went back to school to study public health, and since 2019 have been working on topics and projects that Anne mentioned, and like to say that I try to have a pretty holistic view to, substance use, addiction, treatment, harm reduction, and recovery, and, try to present a wide range of perspectives. You'll see here, I often collaborate with my husband, Graham McIndoe, who's a photographer who's been open about his history of addiction, incarceration, and recovery. So, that has shaped both kind of my interest in this work and how I approach it. And you see a couple photos there. We've collaborated on exhibitions and public art campaigns, really trying to combine photography and quotes from people both, affected by these issues, as well as working in the field and family members in ways that are accessible. So, this will be a 4-part series, taking place every couple of weeks, and we'll talk about upcoming topics at the end. But just broadly today, the learning objectives are to examine sources of information that shape popular views about substance use, addiction, treatment, and recovery. Sometimes we don't kind of take that step back to do that. So we're going to start off doing that today. And then discuss how news, entertainment, and social media coverage of these topics can fuel stigma and misunderstanding. We'll also review drug use surveys and discuss different reasons why people use drugs, and distinguish between different types of substance use and the criteria used to determine if someone has a substance use disorder. So that's just a broad overview of some of the topics we'll be covering. So starting out just with that question, inviting people, please use the chat. And if you're able to, or in a place where you're comfortable speaking, great to, let us know and you will unmute you, or you can unmute yourself and speak. But thinking really broadly, what are some of the ways you learned about alcohol and drug use, addiction, treatment, and recovery? So think about all the sources of information that shaped your views, people, experiences, culture. And we'll be monitoring the chat here. Okay, someone writes, living it. Dare in grade school. So, some of these public education campaigns. So media, that's pretty broad. I'm going to kind of prompt people to think a little more specifically. What are some of the categories of types of media? Great. Personal experience, friends and family. Few people are mentioning family members. Work, so places that you've worked, possibly training. Okay, getting a little more specific here, people mentioning music, movies, TV. Any specific, if you're thinking about those kind of popular culture, films or, books or TV shows or music that kind of come to mind? Not necessarily just for your own, but just kind of broadly, what are these sources? Scarface, great older film. Flight, another film starring Denzel Washington. Yeah, Family and Church, When a Man Loves a Woman. Blanking on the stars of that. TV show called Euphoria. Yeah, so often that's popular sometimes with kind of younger people that I've worked with in workshops or even students. Leaving Las Vegas. Yeah, how things have changed over time. We're going to be talking about treatment a bit more in a later session. Yeah, pharmaceutical companies. So we'll be talking about that as sort of an influence. Shameless, another series. Great. So some of these have been mentioned. I just kind of put this together to kind of prompt people to think about the fact that, for many people, particularly who don't necessarily work in this field, but even for some people working in it, a lot of what we think and feel and believe and understand comes from these other sources, So flight was mentioned. I'm glad someone mentioned music because that is really, sometimes an overlooked source of information. I'll talk about some of the research around that. The top one here is a headline from a news magazine, so a lot comes from, whatever publications we're reading, and a couple of these are books, some that have been turned into, series on Netflix or other streaming services. Some memoirs are sometimes turned into movies. So all kind of great sources that provide information and, often insight into experiences many people either can relate to or haven't had, but also can be, sources that show, particular pathways that might not be representative and certainly not necessarily kind of all the different types of experiences people have depending on, who's highlighted in media and entertainment media. And in a recent workshop, someone pointed out advertising and marketing, and I hadn't really included that before. So, really important source. We live in a country where, pharmaceuticals can do direct to consumer advertising. And now, if you just think I recently traveled and even just going through airports and the amount of, duty-free alcohol and things like that, just the images and ads we're all surrounded by and exposed to here, billboards in some places, driving. So the next question, and again, anybody who feels comfortable speaking, really encourage that as well. But now thinking about these sources, what are some of the messages news, entertainment, and social media communicate about substance use, addiction, treatment, and recovery? So what are these themes? What do people maybe take away from that, even if it's not something that you personally believe? What are kind of some of these dominant messages? And again, someone's pointed out these things have changed and can change over time.
You can go ahead and share, Leanna, I'm sorry. Sorry, let me unmute you.
Yeah, really welcome people to speak. If we might just have to work out the muting and unmuting. And if you can unmute yourself, that's great.
So Leanna, you should be able to unmute yourself. There you go. Yep.
It looks like you're unmuted, Leanna. So if you're speaking and we're not hearing you, then we can shift to the chat and I can try to summarize. Should we come back to Leanna? It looks like.
Yeah, let's come back to Leanna. Alicia, why don't you try unmuting? Let's see if that.
Hello?
Yes, great. We can hear you.
So something that I see is the humor that people find with those that are suffering in active addiction.
Can you expand on that a little bit?
So, like on social media, like you see people taking videos of people that are nodding out, or, and then you see the comments about laughing, like they're really finding humor in somebody else's
Distress, maybe.
yes, distress, yes.
Yeah, and pain. So that's why I was kind of trying to unpack that word humor. So thinking about, sometimes it is to get a social media reaction like a laugh or a like, but also, can be about shaming that person or judging, but making light of it, or sometimes hard to know the motivation, but definitely, that comes up. Um, it looks like Anastasia has a hand up. Do you want to unmute and add to that?
Okay, so I'm sorry, I've got my mouth full of breakfast. I didn't think I'd be able to be called on or be seen or be able to unmute, but so under entertainment, I like to watch soap operas. And I notice in my soap opera, every time anybody has an intense feeling, they have a drink. Anytime they're doing business, they pour hard alcohol into a glass and share that together. So that's all I wanted to say. Thank you.
Yeah, that's great. And thinking about, shows that cover that like relationship with alcohol as well. So anybody who watched Mad Men, about the advertising industry, that tendency to, you know, glorify or normalize not just drinking, but sometimes excessive drinking, is the kind of dominant theme in some media sources. Thanks for sharing that. Looks like Nirmala has a hand up.
Yes. Hi. Hi, I'm from Oregon. I agree with the earlier comment, but some of the movies I've seen, like Flight, for example, uh, you know, it's like hopeful
Mm-hmm.
that you can recover. There was that young gal, and then there's Denzel. And then in Oregon, we had a very effective campaign, maybe a decade ago, on meth use, and it was like your brain on meth, and they would show like a fried egg.
Mm-hmm.
So that's another image in my head, and I'm sure in many other, other people's, it influenced them. So those were like two big things I wanted to mention.
Great, thank you. Yeah, so it's not that these sources only promote kind of negative images or themes or, pathways. So, sometimes it can be a way into understanding an experience or at least feeling connected to other people who might be, in some cases with the, some of the films or books supporting a loved one. And then research is kind of mixed on some of these public education campaigns about substance use and, whether they end up backfiring and, having the unintended effect of having more adolescents end up, trying marijuana or kind of reacting to, some of that just say no era. So, I think we're coming around again to an era where people are trying to figure out how do we do this kind of education, particularly with students, young adults, and get these messages across in a way that is accurate, and also kind of acknowledges the realities that, of substance use, in different places and eras and ages. Just to kind of add to here, and Leanna, if you want to try again, just feel free to interrupt me because it's hard to tell if you're going to be able to share other than in the chat, but just reading, some of the responses here, that substance use is bad, that people lack morals, crime definitely depicted a lot, sometimes glamorized, someone writes, absolutely. Pessimistic views of treatment and recovery, that many folks just relapse, starting to be some change, that's being pointed out here in this comment in the chat. Definitely tendency to shame. I'm going to talk about what some of the research shows, particularly about news media, certainly reinforcing stigma. Again, we are seeing some changes with that in the last decade. But, definitely some of the themes that you've mentioned come up. So, as part of my work in graduate school, this was something that I focused on is what does research that's been conducted show? So this summarizes some of that, particularly media stereotypes about people who use drugs, looking more at traditional news media, so not capturing social media necessarily, but finding that the news media presents more negative portrayals than in entertainment media. More negative portrayals of both the people and then just substance use in general. Probably won't surprise many people that there are differences based on the substance used. So, someone drinking may be less stigmatized than someone using crack or heroin, and certainly differences based on race, ethnicity, and class of the individual. So again, this is focusing a bit on news. Television and photos, so the video and the photography are more likely to reinforce negative or inaccurate stereotypes, both about people who use and sell drugs. So the text of an article may be more neutral, but particularly in earlier eras, the go-to news footage you might see on local news or the images that, were used in print media tended to be more negative or inaccurate than actually the text. And by perpetuating stigma, news coverage can contribute to the social isolation of drug users, distancing by family members, more societal acceptance of punitive policies, and reduced likelihood to seek treatment. So, these are all just kind of some of the conclusions or themes that I've found through this research. Just wanted to kind of ask if, I think there was another person who might wanted to add a comment. Is it Lauren? Well, feel free to unmute or, trying to keep this a bit casual. So can you unmute?
Yeah, I think it's working. Can you hear me?
Yes, great.
Okay. So like when you initially asked that question, my go-to was like bad crime, this, and I'm 48 years old. And initially when my whole drug and everything started, I was 19. So a lot has changed. So today in South Georgia, we have a very strong peer force.
Mm-hmm.
And it's just awesome. My organization supports me. I got afforded a role due to my experience with, of course, I'm in recovery, right?
Mm-hmm.
A lot of times we hear relapse as a part of like recovery, and it's not. That's a part of addiction. Like recovery is real. It happens. We change our lives. And I'm valued due to my lived experience. So it
Great.
is slowly changing. That's how I got my role, as a forensic peer. I'm helping people navigate the judicial system, probation, and transition back into, the community.
Great. Well,
So,
congratulations and thanks for sharing that. Yeah, definitely. I feel since, my husband, so started really dealing with this issue back in kind of the 2005, 6, 7 era. And, when we even first started being open about his trajectory, how it impacted me, very different than us talking about it now. And I think, that sort of different ways of presenting relapse and kind of the normalization of that, or and thinking about how that can also, despite the fact that it is a reality as people attempt, and we'll be talking about that more, but thinking about that can create pessimism for people, about the prospect of recovery. And we'll focus more on recovery in a future session, but thanks for everything everybody has shared here. This person might be familiar to some of you, so even just kind of thinking about what Lauren just spoke about, William White is a researcher, person in recovery himself, worked in clinical settings for many years. And, in some of my earlier work kind of encountered, this essay that he had written about, the media and addiction recovery, and just basically, we've talked about some of the, harms of the way news covers substance use. And he kind of shifted this to, some of the harms of the fact that popular media coverage of addiction recovery is rare, often poorly selected, and told through a lens that does little to welcome the estranged person back into the heart of community life. So, I'm going to kind of advance to the next slide, but you'll receive all these slides, and, the links go to the source material. But this really struck me as we were kind of trying to be open about my husband's recovery, and the responses we got, even when we were being interviewed by people working in news media, and just kind of the pessimism, or, waiting for things to go bad, basically. And what's the source of that? And, some of the points that William White makes are that, distorted media coverage of active addiction can fuel social stigma and contribute to the discrimination that many people in recovery face as they enter the recovery process. Media outlets often portray addiction recovery as an exception to the rule, and media coverage, particularly of drug-related, what he describes as celebrity mayhem and deaths, can contribute to the professional and public pessimism about the prospects of successful long-term addiction recovery. And another interesting point, I think this is shifting a bit, but sometimes, news media can focus on someone in early recovery rather than long-term recovery, and how, that shapes narratives in kind of different ways. And also a tendency to tell recovery as a personal story rather than a larger story of the role of family and community in the recovery process. And certainly, tendency to depict a single pathway of recovery, specialized, often residential treatment, followed by, lifelong affiliation with a 12-step recovery program. So, he's not criticizing those programs, but just that we're not seeing kind of diverse pathways as much in the media, though this gradually is shifting. So kind of thinking about that, personal experience, some of you have mentioned things in the chat, and this doesn't have to be your own experience, but just in general, what are some of the ways personal experience with alcohol and drugs, addiction, treatment, and recovery can shape our attitudes and beliefs? There's no right or wrong responses here. And again, it doesn't have to be your own personal experience, but thinking about someone who has personal experience with this, how might it shape someone's attitudes? Yeah, so it can make you compassionate or burned out or both. I see, Nirmala, you've got a hand up, and feel free. It looks like you're unmuted.
Yes, sometimes, people look at it as a moral failure. So it's like a personal failing. So that's often quite pervasive in our culture. That you brought it on, and and that you're essentially a bad person. So
Right. Yeah, and I think that those attitudes persist, you know, even as there's more education about, you know, and we're going to talk about, you know, the criteria shortly, you know, to meet, to be considered having a substance use disorder or addiction. But just that this, you know, idea that it's, you know, someone is a bad person or it's a sign of moral failure or something else, to be struggling specifically with addiction, and sometimes even just to be using substances. Yeah, so other comments, you know, it can make people intolerant, or, you know, these personal experience can lead to kind of more numbed feelings. It may create empathy with others who know someone who is struggling. Um, can cause someone to be open to working with people who have or are dealing with active addiction. Great. So just kind of trying to capture some of those, you know, and just thinking about this is, you know, a lead in and maybe a way of summarizing the question I just posed. But if you just kind of imagine if you have a close friend or family member who sometimes uses drugs without harmful consequences, who struggles with addiction, who's currently in treatment, who participated in treatment, then started using drugs again or substances, who is in jail or prison because of drugs, who fatally overdosed, who is in stable long-term recovery, you know, how might each experience shape your attitudes and opinions? You know, that's kind of more of a rhetorical question. Probably move on a little bit for time, but, you know, I'm going to show an example here of, you know, it's not necessarily that any one of these questions or bullets leads to a particular attitude. You know, someone might have had a loved one who fatally overdosed, who doesn't end up feeling pessimistic about the prospect of others. That might kind of energize them to want to help, to feel hopeful. But all of these things can shape people's attitudes in certain ways. So, you know, just kind of trying to encourage openness or thinking about how these sources shape, you know, what we believe or what we think we know. And this is an example kind of hitting back or going back to media, you know, in recent years, you know, this is from 2018, but even people working journalists have been more open about their own experiences with addiction. And this is, you know, an op-ed actually, by an opinion editor previously, not sure if he's still in that role at USA Today, but writing about, you know, very openly about the fatal overdose of his son. And, you know, this is some of what he writes here, you know, and thinking about how that might shape how someone assigns, reports, or edits stories. You know, so he's talking about some things that he and his family learned, after his son's fatal overdose. You know, that overcoming addiction isn't merely a matter of willpower. You know, that hitting bottom is not the answer. You know, that this epidemic or overdose or addiction does not discriminate, can impact anyone. You know, that medication assisted treatment, we'll be talking about that in a future session. Medications for opioid use disorder holds promise, but is no cure all. You know, the state of addiction treatment in his op-ed is a national disgrace. So, you know, just sharing really his own experience, talking about that, being handed a piece of paper with the names and phone numbers of treatment and detox centers. And he says, as a journalist, I'm trying to find credible information in a hurry, but I was overwhelmed. So really capturing, the perspective, you know, that many people can relate to, particularly helping, people try to find help in that situation. Just kind of looking at the comments here, you know, the fact that, you know, inpatient or residential treatment, which actually is a smaller percentage of people than who receive outpatient treatment, isn't enough, you know, if people don't get other help or certainly aftercare. And, you know, we'll be talking more in the next session or in an upcoming session about harm reduction, mentioned kind of in the chat here, you know, and, you know, great point that, you know, that kind of polarization between harm reduction and abstinence, as an approach to substance use and addiction can lead to difficult conversations. And, you know, I try to point out all the things that are in the middle of those two, you know, kind of endpoints. So kind of shifting to social media, I mean, part of when we started sharing our story, I wasn't naive about what some of the comments might be, but it is for people who do kind of go public or share, and I do think it's shifting to not necessarily be as negative or more of a mix. But, when I read these comments and on news articles, I'm not on social media as much as many people, but these are some of the themes I was thinking about when I posed that question. This attitude, treatment for the most part doesn't work. Someone writes, my younger brother has been clean for nearly 10 years now, and a significant reason for his turnaround is that he took responsibility for his actions, which may be a really important factor, but no doubt anybody in recovery, there's a lot of factors that help support that. Here's another one, drug abuse, a word that we're shifting, we'll talk about more about some language things, but as a result of behavior and choices, so that idea that someone chooses to use substances, though does not choose to become addicted, definitely appears a lot in social media. At the same time, it's important to recognize that social media has also helped people share their stories and create empathy and understanding. So, it's hard to characterize it as all good or all bad. But this is a obituary from a Vermont publication, and this was a family who, just wrote openly about their family member Madeline, who had died, and was open that she had suffered from drug addiction. And yet, how great that they chose this photo to kind of put out there, and reframe that loss. And that was an obituary that kind of made the rounds on and social media and got some news coverage. But, so that can be a source of, people and family members connecting with each other, as well as a source of kind of some of these types of comments. And just to kind of summarize here, this isn't everything that's been mentioned, but, some of the common beliefs versus current views that address those beliefs are things like, you have to hit rock bottom, and what's kind of been accepted more and learned is that waiting to offer help allows problems to become more severe, making treatment and recovery more challenging. Also, in the next session, we'll be talking more about the current drug supply and just sort of the risk of that kind of waiting, and potentially fatal overdoses. Helping someone is just enabling them. Increasingly treatment programs and other services are recognizes the importance of supporting family members and friends and, maintaining those connections. So, not always cutting out communication with family if someone's in a residential program, or bringing family into that treatment process by, having Zooms or providing information and education. And just even, that recovery is rare. We'll be talking about this survey, but, SAMHSA's 2021 National Survey on Drug Use and Health found that 70% of adults who had had a substance use disorder identified as being in recovery, while 2/3 of adults with a mental health condition said they were in recovery. So, different statistics come up with different kind of numbers for this idea of how many people eventually recover. I'll talk about that in an upcoming session a little bit more, but just that, kind of pushing back on this perception people can have that it's rare with that. So, just moving on, want to present, this is from that same survey I mentioned, some statistics about, substance use, and then we'll be talking more about substance use disorders. But this is a survey that's conducted every year. These are the 2022 results, so still impacted a little bit by the pandemic in terms of both data collection and then, what substances people were using, in those years. But looking at that age group 12 or older, finding that about 1 in 4 adults, well, not just adults, but people aged 12 or older had used what's described as an illicit drug. Now you see marijuana is included in that. So could argue that with that legalization in some areas, but basically, you know, for those substances, that's the percentage of people who had used what would be considered kind of a drug in the past year. So not alcohol, leaving that aside for this particular graph. And you can see that, you know, marijuana use is the highest at 62, nearly 62 million people, hallucinogens and misuse of prescription pain levers, about 8.5 million each, cocaine about 5.3 million, tranquilizer or sedative misuse just under 5 million, prescription stimulant misuse about 4.3 million, methamphetamine about 2.7, inhalants 2.3, and heroin 1 million. It's a very long survey. I'm going to be showing different graphics and results from that survey, but other parts of it, there is a link kind of to more presentation or the full report and different ways the data has been presented. So important to note that the numbers are not mutually exclusive. So someone might appear in more than one category, and that this survey doesn't reach people who are incarcerated in some other institutional settings, people who don't have a stable address. So, you know, kind of taking those numbers with those caveats. Also wanted to point out that, you know, cannabis use increased from about 54 million to 62 million. So, you know, seeing that go up, and that the past year illicit drug use went up from about 22% in 2021 to close to 25% in 2022. So, you know, this is kind of a similar presentation, you know, that's including alcohol. So different time periods. So the previous slide was past year. This is past month substance use. So, you know, and again, they're not mutually exclusive, but you see that bringing in alcohol and tobacco, those are still sort of the top substances people use, you know, and again, looking at the past month compared to some of the other substances listed, you know, including cannabis. So past month use is about 42 million, and then moving down to kind of some of the other prescription pain reliever misuse, hallucinogens, cocaine, methamphetamine, you know, and the others, you know, much smaller numbers, but people could be in more than one of these categories. And, you know, just kind of focusing on alcohol too, which sometimes gets, you know, pushed to the background with some discussions of drug use. But, you know, this also shows the distinction between, you know, the number of people, this is looking at the past month, people 12 and older, you know, 137 million people who use alcohol, and then 61 million, kind of, so almost 45% of alcohol users, you know, answered survey questions kind of that determined that they at least occasionally were binge alcohol users. And then that's red interior circle is looking at how heavy alcohol users. So, you know, that's defined as binge drinking on the same occasion on 5 or more days in the past 30 days. So per the survey, all heavy alcohol users are also binge alcohol users. And just kind of looking at mental illness here, you know, again, from the SAVE survey, you see that about 23% of people age 18 or older, so a little bit higher age range, answered survey questions suggesting, you know, any mental illness. And then the two or the three colored bars, you see that for different age groups, you know, that varies. So kind of higher for the 18 to 25-year-old age range, and then dropping for the older groups. And then on the right, serious mental illness would be I'm just looking 6% of the population 18 or older, and then, you know, again, a little bit higher for the 18 to 25-year-olds. So might not be surprising to, you know, people in this group. Any questions? I can see the chat here, so if you prefer to answer that or ask that way.
Susan, I don't know if you see that question about, and you may want to address it later, about can you be a caregiver without being an enabler? I know that's a big question there.
Yeah, I mean, I think the answer is yes. I mean, it's everything is very situational, but really trying to move away from, that idea of codependency, which, is not actually a mental health diagnosis, but became really popular to talk about. So, and caregiver is pretty broad there. So, it is important to find boundaries for people. And I think a lot of the peer support groups and mutual aid groups are really helpful to people at identifying that. But, even if you think about caregivers, people working in the field too, kind of trying to move away from that word enabling. And, in one of the sessions, we're going to talk about, the importance of why we would offer support and services even to people who are still using substances, and, what some of the benefits are of maintaining those connections with people. So, for friends and family members and loved ones, sometimes it's important to draw harder boundaries, depending on the situation and the relationship, and a lot of family dynamics potentially, or relationship dynamics. But, you could think about caregiver in both those kind of more personal and professional contexts. So these graphics, I'm not going to read through everything on the slides here, but, wanted to share them. I've kind of been looking for different sources that, talk about drug types and effects. And, the second session in this series will be kind of looking a little bit more at the drug supply, but this, not leaving out alcohol and what some of the important considerations are, particularly, I think relevant for people working in counseling roles too, the overlap between alcohol, which is a depressant, and some medications people may be prescribed for mental health or other conditions. So, here too, defining binge drinking as multiple drinks in one setting. So that's 5 or more for men or 4 or more for women. Um, and that there can be an increased risk of alcohol poisoning when combined with marijuana or cannabis, due to decreased gag reflux. Alcohol can lead to serious harms, and withdrawal certainly can be fatal. So, with alcohol, that is why sometimes people are going through kind of more of a monitored detox for that. Yeah, and Anne's pointing out in the chat here, you will receive copies of the slides. So some of this is kind of including for later use or kind of review. Cannabis here, talking about how people might be presenting, both while they're using and some, things they may be experiencing during withdrawal from, stopping or reducing use. So, things like anxiety, depression, irritability, headaches, low appetite, not that everybody is going to experience that, but, these are just some things that might be effects of both use and then kind of stopping or reducing use. Now 24 states have legalized recreational marijuana and 38 allow medical use. So, certainly now there's starting to be more research around what some of the impacts are that's coming out. That's again an area where news and media coverage and social media coverage can be a bit of a wild west in interpreting those study results. But, certainly cannabis has, important uses for some people, particularly, decreasing nausea from chemotherapy. And with increasing use by the population, surveys have also found that perceptions of risk have decreased, including in different age groups. Opioids certainly a broad category that we've been talking about much more in the last decade. And, that would include heroin, opioid analgesics or painkillers, fentanyl, and, a newer kind of class of opioids, not necessarily new, but new appearing in the drug supply you may have heard about, called nitazines, sometimes pronounced nitazines. I'll be talking more about those, but those are actually, they've never been approved for medical use and are more powerful even than fentanyl. The key factor about opioids is there's a risk of fatal overdose in high doses when your tolerance is lowered or when mixed with other drugs, particularly other central nervous system depressants. So that includes alcohol. So any of those things that, you know, depress your central nervous system, when mixed, can increase the risk of an overdose. And that will be a topic too for the second session. You know, this focuses on, you know, specifically crack and cocaine as stimulants. You know, important to note, despite sort of the distinctions, particularly within the, you know, criminal legal system, but crack is chemically identical to powder cocaine. Symptom presentation may mirror psychosis. They have similar effects with the use of amphetamines, including methamphetamine. The acute symptoms of methamphetamine use can be more severe and withdraw longer with methamphetamine versus cocaine. And, you know, overdoses involving stimulants have been increasing. So, you know, these are, again, some possible presentations. While someone's using cocaine or crack, you know, some overlap with methamphetamine, and then during withdrawal. And then, you know, certainly for kind of a counseling audience, benzodiazepines are also, you know, showing up in more kind of post-overdose mortality, you know, looking at and analyzing what drugs were in people's systems. So, you know, definitely dangerous combined with opioids, but they are often used in conjunction with either alcohol or opioids, so that can increase the risk of a fatal or even non-fatal overdose. Importantly, benzos purchased on the street or online may include fentanyl, which can also increase the risk of a fatal overdose. Typically prescribed for anxiety disorders, and, you know, withdrawal can be fatal in some cases. So, you know, definitely more cautions about, you know, particularly combining, you know, for someone who's been prescribed these drugs or is obtaining them without a prescription with other substances. Any questions? Right, my next question for all of you is, you know, thinking about, again, broadly, what are some of the reasons people use alcohol or drugs? Numbing. I'm just reading the chat here. To cope. Trauma. Stress. It feels good. Great to see acknowledgement of some of the positives as well. Depression. Relaxation. Avoidance. Anything else come to mind? Coping with pain. To sleep. To fit in. Great. Important to kind of consider that peer pressure coming up too. You know, so those environmental influences, you know, and thinking about different age groups too, you know, the reasons may shift over time. So this is a slide that captures things that have kind of been mentioned, as well as kind of some things in research. Certainly not, you know, comprehensive, but really gets to a lot of the things that, you know, have been mentioned in the chat, in addition to some others too. You know, yeah, definitely some genetics or heredity, you know, social acceptance, yeah, academic performance or weight loss. Those are good ones I should kind of add here. So, you know, you can see here that this sort of presentation captures a lot of different things that, you know, maybe, you know, what you might describe as positive reasons, as opposed to kind of some of the more negative ones that dominate news recently, you know, kind of talking about deaths of despair and, you know, coming through the pandemic in particular, and some economic conditions, you know, just people using substances for, you know, to cope with stress, and grief and trauma, mental illness, pain, you know, but then also for escape or socializing, sex, sometimes referred to as chemsex, when people are kind of combining certain types of substances, and avoiding withdrawal. So, you know, sometimes people are continuing to use simply so they don't go into withdrawal, particularly from opioids. so self-medication is certainly comes up. And, in some settings, I do hear people mention boredom, sometimes that's one that kind of gets overlooked too. So, this next slide here kind of shows that, just going to adjust that slightly, that these things can also be grouped together in different ways. So the reasons people use one substance may be very different than the reasons they use a different substance. And the reasons for using any substance can change over time. So if you you put together these clusters in different ways, you might have one group that you would think of as applying sometimes to a teenager or young adult versus a veteran or an older adult. So important to kind of acknowledge that, there's not just one reason for one individual, who is typically not just using one substance. And that sometimes it's important to kind of understand these clusters. And then if you start thinking about, services and treatment and recovery, that if they're using the substance to deal with these situations or feelings or conditions, and then trying to take away that substance or reduce or quit, how will they deal with, things like socializing or coping with pain or stress? So, what can be offered as part of the treatment and recovery process for that, or even a harm reduction? Any questions? Comments? Again, feel free to unmute. So the next couple graphics I'm going to show kind of depict these types of substance use. And, this one describes it as a continuum, but important to note that just because someone is over here on the left at experimental or social or occasional use doesn't mean they're going to end up inevitably at dependence or addiction or even harmful use. So, experimental use might be someone trying a substance out of curiosity and may or may not use it again. Social or occasional, person uses the substances in an amount or frequency that is not harmful. Medication used as required, with more people, taking prescription medications, important one to include. So their person may be using opioids as prescribed under medical supervision, or benzodiazepines or other prescription drugs. Harmful use, the person experiences negative consequences of medication or substance use. We'll talk about some of those consequences when we talk about criteria for a substance use disorder. And then on the right side here, dependence or addiction, or what would be considered a substance use disorder. So someone becomes psychologically or physically dependent, both either on a prescribed or non-prescribed substance, and continues to use despite experiencing serious problems. So, someone could be on a different place for different substances. They can move back and forth. And, this is another presentation that kind of captures that bidirectional relationship, a little bit differently. So, similar categories here between experimental social use, moving into kind of regular problematic or harmful use, and then dependency, but is just a different way of kind of looking at types of substance use. So, increasingly we're kind of seeing movement toward using, substance use disorder, and, so helpful to present both the definition and what the criteria are for that. So, comes from SAMHSA, so defines a substance use disorder as when the recurrent use of alcohol and or drugs causes clinically significant impairment, including health problems, disability, and failure to meet major responsibilities at work, school, or home. So this kind of distills it in, a nutshell. And then there are actually 11 criteria that are used to diagnose a substance use disorder. So these come from the Diagnostic and Statistical Manual of Mental Disorders, and DSM-5 for those who are in that field. So the first category here refers to loss of control. So someone might be using a larger amount of a substance or using it more frequently than they intend. They might be trying to stop or cut back and not being able to control their substance use. They might be spending a lot of time obtaining or using a substance or recovering from its effects. They might be experiencing a strong desire or craving to use a substance. The second category refers to interpersonal consequences. So, that failure to fulfill multiple major obligations at work, school, or home due to substance use, continuing to use despite causing social and interpersonal problems, and perhaps skipping social, recreational, or work activities because of substance use. The next two or sets of categories here are risky use, So using in physically unsafe situations, continuing to use despite physical or psychological problems. And then finally, physical dependence. So someone might develop a tolerance or need more of the substance to achieve the desired effect, or experience withdrawal symptoms after quitting or reducing use. So that would be for some substances, particularly opioids or certainly alcohol. Important to note that tolerance and withdrawal in the context of appropriate medical treatment do not count as criteria for a substance use disorder. So if someone's taking opioids to manage pain, for example, with cancer, that wouldn't be considered a substance use disorder, despite meeting some of these criteria potentially. Also important to note that substance use disorders are classified as mild. So if someone fulfills 2 to 3 criteria, moderate, 4 to 5, or severe, 6 or more. So, moderate to severe equating to what, we might be considered or talked about as addiction, or, it's certainly popular perceptions of that. So you can see that, thinking back to that, some of the National Survey on Drug Use and Health statistics, there can be a real difference between someone who has a mild substance use disorder versus severe. So that's why that's kind of become, a broader category in reference to kind of particularly population surveys. Any questions on these criteria? And feel free to add them to the chat as we're going along. Just asked that one. So next one would be, what percentage of the US population age 12 or older would you estimate had a substance use disorder in 2022? So this would be according to surveys, not necessarily a clinical diagnosis of that individual. So the first one is 10%, the second is 15, and the 30 is 20% or more. Great, see some answers coming in here. Okay, a lot of people estimating kind of in different ranges here. Great, so this is actually, what the National Survey on Drug Use and Health found was about 17.3% of people aged 12 or older met those survey criteria for a substance use disorder. So again, this is going to range from people on that mild end to the kind of moderate or more severe, and also importantly includes alcohol. So you can see that of those, the largest category, almost 30 million, alcohol use disorder versus about 27 million for any type of drug use disorder. And then breaking it down, 19 million, give or take, with marijuana use disorder, about little 5.5 million with prescription pain reliever use disorder, and then lower, 1.5 to 2 million for stimulant use disorder, methamphetamine use disorder, cocaine use disorder, and then just under 1 million for heroin use disorder. So these aren't mutually exclusive categories. People could appear in more than one category, and isn't a clinical diagnosis necessarily, but still that's the number. And it is a little bit higher than, previous years that survey was conducted. So in 2021, it was about 16.5%. So, creeping up a little bit, and that this survey does miss certain populations. So, and maybe potentially populations you work with. So kind of take it with a bit of a grain of salt in terms of these not being a clinical diagnosis, very broad category, and miss some populations. Any questions? So this is just a different way of kind of presenting some of the data from that survey, you know, looking at that overlap. So the blue on the left side is people who have just alcohol use disorder. So not a drug use disorder. Doesn't mean that they might not occasionally use drugs, but that's alcohol use disorder. Green in the middle, people who have both an alcohol and drug use disorder. So that's 16.5% of people with substance use disorder kind of have both. And then people with just drug use disorder, close to 40% of people with substance use disorder. So you can kind of see that, you know, these are categories that have some overlap in the middle, but there's also a large population, 20 million give or take, that either have just alcohol use disorder or just drug use disorder. And this kind of looks, I'm going to show a couple different ways of presenting, you know, differences on the severity level. So, you know, the red refers to a severe substance use disorder, the lighter blue, a moderate substance use disorder, and then the darker bluish green, kind of a mild substance use disorder. So you can see for alcohol and marijuana, the majority of substance use disorders, again, according to the survey, are mild. That pattern shifts on the right, you know, seeing cocaine and then methamphetamine. So for both of those, almost 50% of people who have a substance use disorder or with those substances, you know, it would be considered severe. So, you know, some of that might not be surprising either, that, you know, moving into different types of drugs, there might be more likelihood that someone has a substance use disorder that's considered severe. So that would be meeting, you know, 6 or more criteria of the ones that we just went over. And then moderate is in the middle, so about 4 or 5. Any questions? Still got the chat open here, so feel free to post anything, or if you want to unmute, that's great. Some of these slides, again, you know, you'll be able to look at them a little more closely, get kind of complex on a Zoom screen, but broadly, this shows any mental illness, serious mental illness, or substance use disorder in the past year among adults age 18 or older. So on the left, those circles are kind of the overlap or not with any mental illness. So, you know, the green in the middle would be 21.5 million people had some type of substance use disorder and any mental illness, whereas the blue would be the substance use disorder without any mental illness, and the yellow would be any mental illness but not a substance use disorder. And then on the right, those circles refer to serious mental illness. So about 7.5 million people had a substance use disorder as well as serious mental illness. On the left of that right side, they had substance use disorder but not serious mental illness, or serious mental illness in the dark red but not substance use disorder. I know that's a mouthful there, but any questions on that data? So this kind of combines some of those previous concepts here, looking at substance use disorder severity level in the past year among adults 18 or older by past year mental illness status. So on the left, you know, for people with no mental illness, about 8.2% had a mild substance use disorder. That tiny bar in the middle, the 2.7% moderate substance use disorder, and then close to 2% with a severe substance use disorder. Probably more relevant for people kind of working in the mental health field, these 2 bars, you know, in the middle on the right, any mental illness. So, you know, about of those people with any mental illness, about 16% had a mild substance use disorder. Again, these are adults 18 and over. close to 9% had a moderate substance use disorder, and 11.5% with a severe substance use disorder. Moving into serious mental illness, you know, the numbers kind of creep up for that overlap. So, you know, about 18.4% had a mild substance use disorder as well as serious mental illness. 11.5% had a moderate substance use disorder as well as serious mental illness. And a little over 18% had a severe substance use disorder as well as serious mental illness. And then the text on the right just kind of reiterates the definitions for mild, moderate, and severe substance use disorder. Any questions or comments on that? So many of you may have heard the phrase co-occurring disorders. So, you know, that broadly is a term used to refer to the coexistence of both a mental illness and a substance use disorder. People with mental illness are more likely to experience a substance use disorder than those not affected by mental illness. You know, according to the National Survey on Drug Use and Health in 2022, about 21.5 million adults in the US have a co-occurring disorder. So some of the most common mental disorders seen in substance use disorder treatment include, you know, anxiety and mood disorders, schizophrenia, bipolar disorder, major depressive disorder, sometimes conduct disorders, PTSD or post-traumatic stress disorder, or ADHD, attention deficit hyperactivity disorder. So also important to kind of note that, you know, it's kind of a bi-directional relationship. So, you know, certainly people may begin or use substances to deal with a mental illness, or they might develop any of these conditions as a result of or related to what's going on in their life while using substances, or if they have a substance use disorder, if that makes sense. So, you know, co-occurring disorders are not uncommon, and I think, you know, more can be done to kind of refine some of this data collection, but hopefully, you know, that gives a bit of a snapshot of what some of the overlaps are, particularly for people working in mental health roles. So that wraps up the slide presentations that I have. So, you know, wanted to open it up to any questions and also point out that the next workshop in this series will be covering current substance use trends and evolving risks. So, you know, looking more at, you know, things I've mentioned, fentanyl, as well as other substances, some you may not have heard of, and overdose risks, as well as a bit of an overview of kind of risk factors for an overdose, responding to an overdose, how to use naloxone, where to get it. And that would be April 10th from 11 to 12:30. And I think Anne is going to put the registration link for that in the chat. But, you know, some of the things we'll be talking about are the increasing potency of both plant-based and synthetic drugs, really the shift toward more synthetic drugs. So those are things that are manufactured with chemicals and don't come from plants. And again, how to prevent, recognize, and respond to an overdose. And then the two future sessions will be addressing harm reduction principles, strategies, and limits, and understanding addiction and options for care. So I see Anne has posted the link to the April 10th training in the chat here. So, you know, that's available if you'd like to register for that. But still want to kind of take time to, you know, answer any questions. And also, you know, if there's specific topics you'd like to see covered in future trainings, please add those to the chat. You know, great to hear if there were things related to what I covered today or upcoming topics that, you know, would be helpful for the work you do. Feel free to add those. I'm going to just take a moment to see if anybody has any questions or comments. Feel free to still add those to the chat. I'm going to turn it over to back over to Anne here to kind of talk about some feedback, the survey link, and other resources available from the, I'm not even going to try to say it, MHTTC.
Thanks so much. Thank you, Susan, for a wonderful presentation. Thanks for all the participation. Oh, Anastasia looks like she has something to add. So
Yeah.
before
So, yeah, just a
Yeah.
question.
Yeah.
I'm trying to recertify with my peer support certification. And I'm interested to know if I will receive a certificate of completion with 1 credit.
Yep. So what we do is send you a certificate of attendance with the time listed for this session. So for an 1.5-hour session, you'll receive that within the upcoming days. Give us a few days to get that out to you, and then if you have trouble accessing it or anything else, please don't hesitate to reach back out to us.
All right. Okay. Thank you.
Thank you. Okay, in addition, before you log off, and thanks for all the comments, kind comments and thank yous in the chat. If you could click on the training survey, we'd love to hear from you. If you click there, it's a very brief survey. It'll take you a minute or less to give us some feedback. And then there is also an opportunity to provide input regarding additional topics and sessions that you'd be interested in getting additional trainings on. So you can put them in the chat here if you have thoughts now about other topics, or if there are things that you would like Susan to address in upcoming sessions, you can put those in the chat here as well. But if you could provide feedback via our training survey, that would be great. SAMHSA looks for those and is one of the ways that we're able to show SAMHSA the benefits of the trainings we're provided. And there's a QR code on your screen now, if that's helpful for you as well. Takes you to the same place as the link. And I think you can just leave it there, Susan, that's fine, so people can get a chance to scan that QR code. And again, thank you so much, Susan. Really appreciate everything you've shared with us. If you all are interested in joining the second session, I did post that link earlier, but I'll post it again just so you have it right at the ready. We'd love to have you there to learn more from Susan. There it is. So welcome. Oh, I'm sorry, Angela. I see. Yes, it was 11 o'clock Eastern time, not Central time. I'm so sorry, but we have recorded this and we will post the recording to it. So you'll get it as part of, since you've registered for this session, we will send out the slides and the recording so you all can access that. Thank you all. Thank you, Susan, again. And we look forward to seeing you in a couple of weeks for Susan's second session on current substance use trends and evolving risks. Have a good rest of the day. Enjoy. And yes, if you'd like to connect with us for any reason, there's our email address, our phone number, and our website, and also our socials. Thanks so much.
Thank you, Anne. Thanks to all of you, and really appreciate your comments and questions and participation today, and hopefully see you in a couple weeks.
Thank you all.
Leave the chat open for a little bit. I'll show the last side. There you go. In case anyone wants to sign up for the mailing list.
That's right.
I'm going to stop my video, but I'll still be here. So if anybody has any questions. I see Angela's asking. So yes, it will be at 11.